Asphyxia is a condition characterized by the lack of oxygen, and it's basically a very common kind of death, a very common mode of death observed by the forensic practitioners. Now, asphyxia should be differentiated from suffocation. How do we do that basically? Suffocation is just the blockage of the passage of the airways for the air entry. So, how do you basically asphyxia? Again, as I'll emphasize on this, that it's basically an interruption in the oxygenation of the tissues. It can be, this interruption can be caused by the carbon dioxide, and it's not just the air entry which is blocked in the asphyxiation. So, there are also other methods through which this oxygenation of the tissues can be blocked, and it is basically a broader term used for the deaths caused by the lack of oxygen. Again, it's not all asphyxia. The condition of asphyxia doesn't always end up in death. It can only lead to unconsciousness or any detrimental conditions other than death. And then finally, if it is a very worse kind of asphyxia, then it can lead to the death of the person. So these terminologies have to be very clear in your mind when we are talking about the asphyxial deaths. Now, in this section, we'll be dealing with the nature of asphyxia. Obviously, as I was already commenting upon, that there are different kinds of asphyxial deaths. Different levels of asphyxiations are observed in different types of deaths. So we have to reach to the point of diagnosis what level of entry was interrupted in any death, in any particular person, in any particular case that we are dealing with. What level of obstruction was caused in a particular person, that has to be diagnosed. This is basically why we are studying all of this asphyxial deaths and these asphyxiation in details and their mechanisms. Now, the mechanical asphyxia and the terminologies are again very important, and they're routinely used in our investigations when they're carried out, the crime investigations, when they're carried out, the autopsies, whenever they are carried out in any person by whosoever the person is, he's always using these terminologies quite frequently in his or her practice. So asphyxia should be differentiated from hypoxia. Hypoxia is a generalized condition that I'll be dealing with, and I'll tell you basically the differences, how to differentiate between an asphyxial condition and any hypoxic condition. Obviously, there is a difference, and basically the basic pathologies are obviously the same. There is a decreased amount of oxygenation in the tissues, but how to differentiate between them, it is very important, and a clinician should be knowing about all of these differentiations. So this is what we'll be dealing with in this first section. Now, the nature of asphyxia is again very important. Nature of asphyxia is marked with basically the lack of oxygen, and again the etymological absence of pulsations. The absence of pulsation is basically an indicator of death or unconsciousness or any basically detrimental condition that the person is going through. So the lack of oxygen, we are going to mention what was basically the level of the lack of oxygen, and the absence of pulsation is again marked by the medical legal officer or whosoever is writing down or documenting the case. Now, the nature of asphyxia. The nature of asphyxia can be basically, it can be the absence or reduction of the oxygen tissues in the external atmosphere. So this is the mainstay that we are basically starting off in a very methodological method. Basically, we are starting off with the environment. First of all, that there can be something wrong with the environment. There can be an absence or even a reduction in the oxygen levels. So this is again one of the causes of asphyxia. Then the obstruction of the external respiratory orifices. I'll be basically mentioning the levels of the respiratory orifices. Respiratory orifices are basically, it can be a mouth respiration, and it can be even through the nasal apertures. So these respiratory orifices can be blocked, and this is basically referred to as the smothering phenomena. So in another slide, I'll be basically dealing with the terminology specifically, and here you can just go through the levels of obstruction. over here in this diagram. Now, the blockage of the internal respiratory passages. Now, even if the respiratory orifices are open, even any blockage to the any initial blockage to the respiratory passages can still be another cause for the asphyxiation. Then dramatic asphyxia. Now, basically, these were two homicidal characters in the history, that is Burke and Harry. And they basically started off with these a chain of events. And this was basically a traumatic asphyxia first recorded in the history. So what they used to do is basically one of the person, that is the Burke, he would sit on the victim. He would sit on the victim's chest, and Harry would just drag him, and they would just basically cause an asphyxia and trauma at the same site to cause the death of the person. So these traumatic asphyxia and their history, basically, obviously there are a lot of variations to these methods. Trauma can be of any cause, and still it can cause the asphyxia, and that will be basically termed as the traumatic asphyxial deaths. They're usually of the homicidal kind, or the rarely of the accidental kind even. Now, the diseases of the lungs. Obviously, if there are any obstructive or restrictive lung diseases, these are the two kinds of diseases, the obstructive and the restrictive lung diseases. Both of these group of diseases can again lead to the asphyxiation of the person. Now, moving on to the reduction in the cardiac function. Now, basically the pulmonary and the cardiac levels are interrelated to each other, and again they can cause the asphyxial death of the person. Now, the reduced ability of the blood to transport oxygen is again one of the methods of the asphyxia, which can be regarded as the mode of death. So, inability of the peripheral tissues to utilize oxygen. So, there can be something wrong with the peripheral tissues, which themselves are basically obstructing the tissue oxygenation methods. So, this can again lead to the asphyxia of the person. All of these methods are going, sometimes there can be a single method, sometimes there can be multiple methods out of these methods, which can basically contribute towards the mode of death of the person. Now, the mechanical interference to the passage of air into the respiratory tract. This is basically termed as the mechanical asphyxia. Now, mechanical asphyxia can be due to the strangulation, and strangulation is again, one of the methods can be the hanging, or the ligature strangulation, or the throttling. So these are basically the methods. Hanging is just by the ligature, and you just basically, the person is hanged through that ligature. So it is a simple definition to the hanging phenomena. Then the ligature strangulation is basically in this method, basically a ligature is tied up through the neck, and the person is not hanged in this case. Then the throttling is usually the manual strangulation by the hands of the person. So that is basically termed as the throttling phenomena. These are the methods of the strangulation. And the compression of the chest and the abdomen, it's basically the traumatic asphyxia that we are referring to right now in this method. Now, in a closed space, and then another method can be through the suffocation. Suffocation, how do you basically differentiate the asphyxia and suffocation? The suffocation is basically the blockage of the passage of the air by blocking the air entry. That is basically known. This is the type of asphyxia that we are dealing with when we are terming to the suffocation phenomena. Asphyxia, as I was dealing, it can be at any level. It can be at the respiratory passages level, it can be at the tissue level. All of these things can be involved. But in the suffocation, we are only dealing with the air entry, and that is blocked only in the suffocation. That is the only pathology in the suffocation process. So this is basically a flowchart that is emphasizing on the mechanical asphyxia and its types. Now, suffocation again can be the smothering. When the mouth is covered, it is basically termed as the smothering phenomena. Choking is at the level of the neck. That is basically at the level of the neck when the trachea is basically covered. And gagging is again at the level of the epiglottis. That is basically known as the gagging because it is where the gag reflex takes place. at the level of the epiglottis. So that is the level of the suffocation in the gagging phenomena. And then drowning. Drowning, it is basically at the level of the lungs. It is happening at the level of the lungs. So this is basically the whole phenomena. The only pathology that we are dealing with, the levels are very important when we are discussing these suffocations and strangulations and hanging. It's basically the levels that we have to keep in our mind, and that we have to mention even in our autopsy reports. So the terminologies that we were dealing with are the suffocation. Suffocation is just the blockage of the air entry into the air passages. That is termed as the suffocation. Smothering is the level of the mouth. So if the mouth is covered and the person is not basically led to breathe, this is known as the smothering phenomena. And then we have the choking. Choking is again termed as the café coronaire. It is basically at the epiglottis level when the bolus of food enters into the tracheal ring. It is basically causing the choking of the person. So that is going to be discussed in detail in the later sections, how this choking occurs and what are the different terminologies and the conditions relating to this. Then the throttling is basically the type of strangulation in which the hands are used. It's basically a manual method in which the hands are used for the compressing the neck. This is basically known as the throttling phenomena. Then the strangulation. Strangulation is basically just when a ligature is used to compress the neck, and hanging is not involved in strangulation, because in the hanging phenomena, the ligature is placed and the compression of necks takes place by hanging the person. So this is how you basically differentiate between different modalities of the asphyxial deaths. And what are the definitions and the levels have to be remembered in detail over here. So mugging, it's again another type of asphyxial death in which the neck is compressed by the bend of the elbow. So it is that the person is basically attacked from behind and the bend of the elbow is used to compress the neck. So it is known as the mugging phenomena. Then how do you basically differentiate between asphyxia and hypoxia? All of their modalities are compared over here. When the body is deprived of oxygen, it is known as asphyxia. On the other hand, in hypoxic conditions, the deficiency in amount of oxygen reaching the tissues is basically known as hypoxic conditions. Now, asphyxia is caused by an injury or obstruction of the air passages, and on the other hand, hypoxia is caused by an inadequate supply of oxygen in the blood. While we are discussing asphyxia, the strangulation, aspiration of food, near drowning syndromes are the examples over here. And while we are dealing with the hypoxic conditions, the reduction of the partial pressure of oxygen and the inadequate oxygen transportation is an example of hypoxic conditions. So in this section, basically, we dealt with the asphyxial deaths and the different types of asphyxias that we come across, and their modalities and their terminologies and their level of injuries. That is the end to this section. Thank you for watching sqadia.com.